Okay, everyone, welcome to our Baby Sleep webinar, Baby Sleep from A to Z. My name is Dr. Natalie Barnett. I'm the VP of Clinical Research here at Nanit, and I'm joined by some fabulous panelists this evening. Dr. Monica Ordway from Yale, Dr. Liza Natali from NYU, and Dr. Michael Gradisar from Flinders University in Australia. I'm going to wait just a minute or so as people start to join. We can see a lot of people joining, which is fantastic. What I would love to do is to tell us where you are joining from. You can tell us that in the chat, and as we go on, you can start to put questions into the Q&A. But if you wanted to tell us where you're joining from, that would be fabulous. And we'll give it just a minute as people start to join, and then we'll hand over to the panelists for them to introduce themselves. Okay, we're joining from Toronto, Canada. Fantastic. We're happy to have you. So hopefully we will have, we've got a lot more people joining. Fantastic. So I'm going to hand it over to Dr. Natali to introduce herself first. Liza, if you would like to just say a minute or two about yourself.
Sure. My name is Dr. Liza Natali. I'm a pediatrician, a general pediatrician in New York City. I'm in private practice. I've been in private practice for about 18 years. And my practice is affiliated with NYU Langone Health. I teach classes for new and expectant parents and grandparents on a variety of topics, including sleep. And I am the mother of two.
Fantastic. And I forgot to mention that I am also a mother. I have 3 boys who are not babies anymore, but they still tend to take up a lot of my time. And Dr. Ordway, would you like to introduce yourself?
Sure. My name is Monica Ordway, and I'm an associate professor and a pediatric nurse practitioner. I'm an associate professor at Yale University School of Nursing, and I study sleep in young children as well as see patients clinically at the Yale Sleep Clinic. And I've been a nurse practitioner for 25 years, I think.
Amazing.
I have 2 boys as well who are not little anymore.
Thanks. And Dr. Gradisar.
Yes, I'm Dr. Michael Gradisar. I am a clinical psychologist and a sleep researcher. I've been doing both for the last 20 years. I'm no longer at the university. I've actually moved out and now the head of sleep science at Sleep Cycle. And just to continue the whole kid thing, I've got 2 kidults and they are both boys.
Kidults, I love it. Fantastic. Okay, so let's jump right in. I see we have a lot more people joining, which is fantastic. We are going to be talking today about sleep health, about routines, how to set yourself up for a lifetime of great sleep, talk a little bit about safe sleep, and talk about how you can, expect how and when you can expect your baby to have some semblance of a schedule and what that could look like. And so I would like to kick it off to Dr. Ordway, actually, and I just would love you to talk a little bit about what do we mean when we say sleep health, and why is sleep health important to us?
Sure, thanks. It's a great question, and one that I feel is really exciting to talk about, because we are really focusing more on sleep health now rather than sleep disorders. So starting early, focusing on 6 dimensions of sleep health. So we talk about sleep behaviors, which is mostly about routines, which I think we'll talk about today. We talk about sleep satisfaction, how well you think your baby's sleeping, alertness, sleepiness. We also talk about timing, of course, timing in terms of the bedtime, but also nap time and how consistent those timing are from night to night. Efficiency, so how much time babies are sleeping at night versus kind of this consolidation sleep that happens as they in the first year of life. And then lastly, duration. Well, we usually talk a lot about duration. I think people focus on that, but it's certainly there are multiple aspects of sleep health, and it's important to sort of have a whole package.
Great, fantastic. Now, and Dr. Natali, can you tell us some common sleep questions that you get, in your private practice about, about sleep, and what you're telling your patients about sleep in those early months?
So in general, the main question is, how do I get my baby to sleep more at night? And variations of that question. What I find is that our understanding of sleep and baby's need for sleep is somewhat misguided. And I think because we don't need as much sleep as a baby, we seem to think that babies sleep too much sometimes, and that's concerning. So for parents. So we talk a lot about not so much sleep training, but getting babies to be, or getting parents comfortable with recognizing their baby's sleep cues. When they're tired as opposed to when they're overtired, and respecting their baby's need to sleep the same way that they would respect their baby's need to eat or be changed or everything else. And sometimes sleep becomes a bit of an afterthought. And so when we're talking about sleep cues and signs of sleepiness, it is not when babies are yawning and fussing and rubbing their eyes. It is, before that. And there are certain windows of time that a baby can naturally be comfortable and awake before they get overtired and overstimulated. And so we talk a lot about that.
Sorry, to that point, can you tell us a little bit exactly what those sleep cues are? And then tell us a little bit about what are you recommending in terms of wake windows for these young infants?
So the sleep cue that I use is they look glazed. I sort of describe it as looking a little bit stoned. They're staring off into space. Everything is very relaxed, and they're kind of almost looking past whatever is in their eyesight or vision. And that is, to me, the first sign of the baby being sleepy, and a cue to the parent that it's time to put the baby down for a nap, meaning ideally off of their body, so that they learn how to sort of sleep comfortably off of the parent, but not necessarily in another room, in the dark, anything like that, but just, physically off of their body in a safe space. When babies start to get kind of twitchy and jittery and, kind of jerky, that is the first sign of being overtired and kind of an adrenaline surge. And then that will escalate into fussing, crying, when you have to sort of pull out all the stops and rock and hold and shush and do all those things to get them to fall asleep, at which point they tend to fall asleep on you. The wake windows change as babies get older. So in general, from birth to about a month, it's typically, 30, what I use is about 30 minutes to an hour.
Yep.
So it's a very short amount of time. Now it can vary, and every baby is a little bit different, but most newborns can't stay up past an hour without getting a little bit overtired. And then between 1 and 3 months, it extends to about an hour to an hour and a half. And then 3 to 4 months, typically around, 75 minutes to 2 hours, and it will slowly, increase. And what I find is that if you focus on your baby's cues, they will dictate the sort of schedule and pattern of what their wake window typically is. So it's not going to be all over the place all day. It's going to be relatively consistent, but for your baby.
Yeah. So to your point, all babies are different. And for some newborns, that wake window might be, 50 minutes. And for some, it may be, 65 minutes, for example, and it's sort of a matter of experimenting, right? And sort of working out what is the right wake window for your baby, rather than sticking to the exact number that it says in the book somewhere.
Exactly. I mean, there's a range for a reason. And I do find that when people are focused on what the internet is saying, or what a book is saying, or what their neighbor is saying, or their mother is saying, they're losing focus on their baby and paying attention to what their baby is telling them. And babies are actually very good at giving us clues if we are open to hear and see them.
Yep. I love it. Love it. Now I wanted to just turn to Dr. Radisar for a minute. And, so we have worked together for many years now, and we have collaborated on a lot of research projects looking at a lot of Nanit sleep data. And it has been, it's been a fascinating journey for all of us. But I was wondering if you could tell us, how you think sort of collecting and reviewing data of your own baby can really help improve your baby's sleep. So how can Nanit help you understand what your baby needs, as well as, to Liza's point, sort of watching that baby and and taking in those sleep cues. What can we learn from our data?
Yeah, I think Liza was fantastic in being able to really look at the sort of short-term acute sort of signs of when to put your baby to sleep. And if you do that on a regular basis, you're hopefully setting them up to sort of fall asleep at a somewhat regular time. It doesn't have to be precise. That's what I guess what we're talking about here is there can be a bit of variability. But sometimes it's also good to sort of like step back and look at the forest. And by being able to measure sleep, through Nanit as well, and have a look at patterns, have a look at sort of roughly what time the infant is falling asleep over successive nights, what time they're waking up in the morning, what time they're sort of having their naps, you can start to see patterns. And before we had the technology from Nanit, we used to use pen and paper sleep diaries to get the parents to basically fill out with little symbols each sort of night when the infant would fall asleep and when they would wake up during the night and so forth. And then even that process of a parent measuring that and looking at basically data for their own infant, and they can see suddenly a pattern over a certain week. They can see almost like a window of when the infant would fall asleep, not necessarily precisely at the same time, but roughly around this sort of time. And I think that can provide a sense of reassurance for some parents that certainly, as much as my infant isn't falling asleep yet, it should be coming soon, and not to sort of panic or sort of worry about it. Because I guess as soon as you start to panic, then that's going to start to maybe feed off to your infant and not necessarily make it a sort of good sort of settling routine. So I think, that's where they can sort of gain that sort of benefit from being able to now look at the sort of data that they're, Nanit's generating for their infant and having a look at those patterns.
I love it. I love it. Okay, so moving on next to talk a little bit about routines and schedules. You touched on it there for a minute, Michael, and said, and Liza, talking about, looking for routines and, having a bedtime routine and thinking about, when do we start a bedtime routine? What does a bedtime routine look like for, for babies? Monica, can you tell us a little bit about why a bedtime routine, is important for babies and why you would recommend families think about implementing one? And two, when do you recommend that they start, and what do you recommend that it looks like?
Sure.
It's a lot there, sorry.
No, it's a great question. I mean, I think that routines, like any routine, as you're, raising your children, whether it's dinner routines, and I think we think more about those, eating together, but generally, just developmentally, infants and toddlers, they're looking at you to sort of help understand the world, right? So it's sort of the parents. So what we call the first mirror that they recognize. They're looking at you for regulation of how they're feeling and understanding the world. And so with that, they may, try to resist especially as they grow up and through infancy and toddlerhood, more in toddlerhood, start to push up against routine. But if you can start early, I just think it's a really great way to really be what we call bigger, stronger, wiser, kind, and sort of a circle of security. So it's a wonderful way of developing a secure attachment. So when you are providing a predictable environment through a routine, it's very comforting to babies as they develop. And about 80% of the brain growth is actually happening in the first 1,000 days of life. And it's the experiences that they're having during the day that help them to develop all of their cognitive processes, or many of them. And so I would say in terms of what I would recommend is from an early age, just starting with something simple. And I like, I think it was maybe Dr. Jody Mendel that said, start with some type of a phrase. So I like to recommend good night, I love you, I'll see you in the morning. So something that lets them know it's nighttime, that you love them, a sense of security, and that you'll see them in the morning, that there's some safety. And what I find is if they have that same sort of message being said to them, then as they get a little bit older, maybe towards 4 months, when their sleep architecture is developing into a little bit more of an organized rhythm, that you can then start to implement something that's like 20 to 30 minutes long, same order each night. So it might be, change the diaper, take a bath, change the diaper, a feeding, read a book, and then down to sleep. Good night, I love you, I'll see you in the morning. So I think when you can keep it short, 20, 30 minutes, read more books. I know everyone wants to read books at night to their children. That's fantastic. But maybe try to do that before the bedtime routine so that at night it's a concentrated, focused amount of, so I think that's probably my focus.
Yep, amazing. Thank you. So, Liza, a question for you. Do you see many people who have a routine that is too long? And what do you recommend that they then do?
So, that's actually a very good question. Yes, I do. I think what it is while babies are creatures of habit and they are comforted, like Monica was saying, they are comforted by that routine, and that's very important. That routine has to be somewhat malleable for the situation. So if you had a busy day or whatever it is, like maybe you can't do the entire thing, but you do sort of the bulk of it in the same, pattern order. And in the space where they're going to be sleeping is one thing that I add, where it's like you're sort of shifting gears. But I find that for some babies, something like a bath is actually not helpful for their sleep, even though it can be very relaxing and theoretically should be very relaxing. Sometimes it's playtime, and sometimes it takes longer and it sort of delays bedtime and gets them excited because it's splashing and quacking and everything, and then and then to bed. So I think it's important that if bath is working, great. If bath isn't working, then it's okay to cut that piece out, even though most of the books say bath. Or, I think that it's about being a little bit more flexible, and also, again, paying attention to the baby's kind of cues. If you've had a busy day or you've had company and it's thrown them off, then maybe it's a slightly modified one, but it doesn't have to be, 20 to 30 minutes seems appropriate. Maybe sometimes it could be 15, sometimes it's a little bit longer. It's being flexible in that way.
Yeah, and I just wanted to reiterate that the bath is not necessarily an essential part of the bedtime routine. For a lot of families, it works beautifully and it is a lovely part of the bedtime routine. But for many families where, it can create more stress for the parents, or it can turn in, the baby could be, get very upset with the bath, or it can be, very difficult for them to then, to your point, to fit it in. It's not something you have to do as part of the bedtime routine. So, if you wanted to shift the bath to earlier in the day, or shift and also, Liza, I'm sure you would say, newborns don't need to be bathed every day, or infants don't need to be bathed every day. If they have a bath every other day, or however often you would recommend, it's not something that is essential to the bedtime routine. So what if it works for you and your family? Fantastic. But if it doesn't, don't give yourself a hard time by cutting it out of the routine and buttoning it up and making it a little bit easier. So we want it to be something that is simple, repeatable, and also too that anybody can do, so that if grandparents are coming to babysit, for example, that they can, implement the bedtime routine, relatively easily as well. So I think that's a nice thing to remember as well when we're thinking about creating that bedtime routine.
Natalie, would I just add one thing that I think is really important? As an example, I've developed an intervention that I'm testing right now with young children, and I have 14 different options for bedtime routine.
Yeah.
And so I think it's really important that the family choose those 3, 4, 5 activities, so that it's something, if prayer is important to you, or maybe singing, or massage is important. So I think, children with eczema maybe shouldn't be bathed. So it's a very good point. But I just want to emphasize that it is something that a book might say one thing, but there's a variety of options.
Totally. Yeah.
Relaxing activities. And it's just trying to choose something that fits for your family in a sort of simple time frame.
Yes, yeah, exactly. Great. And one thing I just wanted to mention too is that we are going to announce a giveaway winner at the end of the webinar. So just hold on tight for that. So your name will be called out at the end, and then our community members will give you the information of the giveaway. But that will be coming up at the end of the webinar. So Michael, question for you: when do you recommend that babies should have somewhat of a sleep schedule during the day?
Damn, you're really coming out with good questions. So I guess when we're thinking about sleep schedule, like you're sort of suggesting, it's like looking at naps, it's looking at the major sort of sleep period overnight. And a lot of that, if we sort of think about the community being parents that have newborns all the way through to, plus 1 year, hopefully they're aware that the sleep biology takes some time to develop. And when we say sleep biology, we're actually talking about 2 processes. One is the ability to sort of build up pressure to fall asleep the longer that we're awake. And that's part of this whole wake window concept. And that does take a while to actually biologically develop in infants. And certainly by 6 months, it looks like it's fully developed. And it certainly is on track around sort of even 4 months of age from the data that we're having a look at. And the other biological component that a lot of people have heard about is the body clock, the circadian rhythm. And that can have a lot of variability as well in terms of when that's fully developed. And that sort of can be somewhere between 3 to 6 months. So everything seems to sort of move towards 6 months when all of these processes are fully developed. That doesn't mean that you can't develop a sleep schedule before then. Certainly you can, because one powerful way that we learn to sleep is through something we call learning theory, and that can happen from day one or night one. So again, about scheduling, like your baby can learn to fall asleep with these routines, and choosing to have those nightly routines as well just before the naps. And again, I would emphasize, being able to really sort of analyze data. That's the sort of scientist in me, just with your infant sleep, looking at the Nanit data that you're able to gather. I also believe there's a sleep schedule generator that Nanit has as well that parents might be able to access.
Yeah, so that's a great call out. So on our website, we have a sleep schedule generator, and it gives schedules for babies from 4 months to 24 months. And so to your point, we would, most people would generally say that, it can be very difficult to expect, much of a routine during the day before 4 months. So we don't have a 4 months, 3 or 2 months schedule on the website. We really want, to Liza's point, we really believe that it's really important to be looking at your baby's sleep cues and really, understanding your baby in those early months. And there's just so much variability in those early months that it can be really, hard to expect much of a schedule on your babies. And we don't want you to be feeling the pressure that your baby must be on a schedule by the time they're 6 weeks, because it can be, biologically almost impossible for babies to do that. So we have very purposefully started our routines at around 4 months, which, we feel is sort of a nice time when you can start to experiment with, having a more regular routine during the day. So I would love to encourage you to take a look at those. You can download those, for free on our website, and they go all the way up to 24 months. But I wanted to talk a little bit now, something that is very near and dear to our hearts is safe sleep. So I wanted to, ask Liza, can you tell us, Liza, what you would recommend for a safe sleeping environment for babies?
So when we're talking about safe sleep, we're talking about a sleep environment decreasing the risks of SIDS or sudden unexplained death in a child, which has been changed to. One thing is being in a separate sleep space than the parent. And so not co-sleeping in the same bed, but you can have a co-sleeper that is sort of right up against the bed so that the baby is in their own distinct space on a firm mattress with no bumpers or loose bedding, pillows, including the flathead pillow, which is something I do not recommend anybody use. And if anybody has questions, they can put that in the chat. And also just in terms of the climate that it's in, free of smoke. And so ideally, those of you watching are not smokers. Appropriate temperature environment. So it's really better for a baby to be a little bit cooler than overheated or overbundled. If babies, I do recommend babies swaddled for the first 3-4 months because I find them to be most comfortable in that position, but making sure that the swaddle is tight so that they're not breaking out of it and then it becomes loose bedding. And I mean, those are trying to think of, I'm sure I'm missing a couple of key ones, but and babies,
I just wanted to do a little bit of a call out. What about like baby lounges that people we often see are people putting their baby lounges in their cribs?
Do you mean like a chair or a?
I mean like a yeah.
Okay. No. So you don't want anything in the crib that is not attached to the crib in some way, basically, except the baby. So if you're putting in a product that is like a lounger that Natalie is describing that makes them feel cozy or whatever it is basically a pillow and it is not safe. And babies can, get their face smothered up against the pillow. And a lot of times parents will say, oh, but I watch my baby all the time. And the reality is that we can't watch our babies all the time because we're human and we turn away for a second or we fall asleep because we're exhausted. And so it's really not ideal to get a baby even used to that kind of setup because we know that it's not safe. And also putting babies on the couch is actually quite dangerous for falling or getting smushed into cushions, or having your baby, lay in the middle of your huge king size bed. We have a lot of parents who I just went to grab something for a second and the baby was in the middle of the bed and they've ended up on the floor. Yep. So where people are co-sleeping on a very hard futon in the middle of their hardwood floor, it's not the same as our sort of elevated beds with soft bedding and cushions, and it's just a suffocation risk as well.
And just something that I just wanted to call out, and I know that you had mentioned that we would always put our babies to sleep on their backs, but we know that the back to sleep campaign has resulted in a lot of babies who have ended up with plagiocephaly or flat head, and so people are wanting to use this this flat head pillow. What do you recommend that they do to avoid developing plagiocephaly?
So once the belly button scab has fallen off, it's important to do tummy time as a very intentional activity on the floor, not on the bed, not on the couch. I find that a lot of parents are uneasy about putting their babies on the floor, but the floor is actually the best place for a baby because you can't fall off of the floor. And it's like doing little push-ups. So babies like to be snugly on their parents, on their bellies, but that's not really the workout. That's snuggly. So you want them to do like a little, gym workout. The earlier you start it, the more they will tolerate it, because once they're about 3 months, if you haven't started tummy time, or they kind of whimper a little and you pick them right up, if they're, rather than sort of get down there and coach them and get excited, they want to see the world. Like, they're starting to see color. They're starting to become interested in what's around them. They don't want to stare at the floor. They're frustrated that they can't look up and see what's going on. And so it ends up being harder to get them comfortable on their bellies. And the idea is that when babies are put to sleep on their back, once they are strong enough to roll from their back to their belly, they can sleep on their belly. And
The
if they
parents don't need to go in and roll them back, for example.
No, and that's why you don't want anything in the crib. At that point, you're no longer swaddling, so that their hands are free. And I don't know about the other sleep experts. You may have a different. I like to go from a swaddle to hands free. I'm not crazy about the devices that kind of short sheet you or keep your hand, because once you've graduated to that point, they may want to sort of wiggle around and move, and having access to their hands, I find, is ideal. I mean, to their arms, to move them rather than have them restricted.
Yep, I love it. Now, and to that point, what would you say are the most common unsafe sleep practices that you're seeing day to day that people don't really know about, or don't sort of, are doing unintentionally?
I think it's these loungers. I think that because I don't see a purpose for them other than for sleep, but they say that they're not for sleep, but they seem quite comfortable. I also think that we project our sleep desires onto our babies. So I would not want to be swaddled to go to sleep. I would be quite uncomfortable. But babies, in the first 3 months actually like that very much. It's very comforting. And so falling asleep with them in their bed or on the couch, which I think for a very tired parent is hard not to do.
Yep.
Which is why it's so important to, start the practice of putting babies to sleep awake and drowsy, so that they can fall asleep. And, if they're always sleeping on you, it's very hard as a parent to function and know that, you're not going to accidentally fall asleep. So those are the main things: putting them on the bed, like, a high surface bed, couch, and having some type of thing in the crib, because they're afraid of babies rolling over, like a wedge or something, or towels, because they're afraid the baby's going to roll over. A newborn is not going to roll over. They might turn to their side, but that's okay.
Got it. Okay, amazing. Thank you. And Monica, to carry on from that, can you tell us in your practice what unsafe sleep practices you're seeing that people are, engaging in unknowingly?
Like anything with early childhood and parenting, it's always well intended, right? So the cases that I've seen that are most concerning or have ended, unfortunately poorly, very badly, is, trying to comfort the baby, and if, parent being, spouse, so I'm going to help, and then falling asleep on the couch with the baby, or, I'm going to what Liza was saying, I'm watching all the time. And I think there's a lot of exhaustion in those first few months for parents. And so I think, this well-intentioned, it's only for this brief time. And I often would say, it's like thinking about when you get in a car and put your seatbelt on right away. You don't even drive a little bit, right? The chances of getting in a car accident are very small, but you still put that seatbelt on. And so following those guidelines are, just really important to protect all babies. So I think it's more that sort of well-intentioned, just this one time, yeah.
And Michael, I'm gonna move on to you for a second. I know you're in Australia, but do you see any differences in the Australian recommendations compared to the US recommendations?
Not at all, because it's all about data, it's all about science, and it's all about safety. It is the same sort of things. I think probably to touch on one point is that parents can get quite confused because they hear another loud voice, which is saying basically that you can co-sleep with your infants, that so many families do this around the world and so forth, but they're not told why those differences exist. The fact that, say, for instance, in Asia, this obviously comes up a fair bit, where there is a lot of co-sleeping, but at the same time, there's a lot of differences which make it more safe in Asia because, for starters, there'll be a more firm surface that they will sleep on. There will also be a lower BMI. And there are a number of factors in the Western world, such as soft bedding, high BMI, whether the parent is a smoker, whether they're consuming alcohol, whether they're overly sleepy, that increase the risk of having that smothering occurring during co-sleeping in bed. And that doesn't necessarily present itself in the Asian countries. But interestingly, if you look at sort of the rates of parent-reported sleep problems in Asia versus, say, Western societies, they're about double in Asia. So it doesn't necessarily mean that this sort of area is the way to go when it comes to trying to help your infant to sleep. I do recognize that there are some parents certainly that sort of go, the only way I can get my infant to sleep is in my bed. And then there is a bit of a balance there because, you know, the parents need to get their sleep because they're looking after their child and they don't necessarily want to have an accident, say, for instance, if they're driving a car and so forth. So I do appreciate that sometimes they just need to get some sleep, but potentially think about your bedding, think about some of those recommendations that Liza and Monica have also mentioned to sort of just change your bedroom environment to find some sort of in-between balance.
Natalie, if I could mention, so the recent guidelines changed to, you know, keeping your baby in the room, not until a year of life, but now it's, you know, 6 months. I will sometimes say to my patients 4 months, but part of that, I think, is that, and part of the reason I say that is because babies are quite disruptive to parents' sleep and parents are quite disruptive to babies' sleep. And so sometimes a parent might be up and hear the baby just sort of chattering or, you know, sounding like a barnyard animal, which they do, and then think, oh, well, maybe I should feed them now because I'm up. And then, you know, so that can be disruptive. Or the baby would wake up and maybe just go back to sleep, but then hears, you know, mom or dad kind of breathing, snoring, smells mom's milk or whatever it is, and then will wake up. And what can happen then is that that disrupted sleep increases the chances that you're going to pull the baby into your bed because you're so exhausted. And so sometimes having a little bit distance earlier is helpful because you're not disrupting each other. I'm not saying across, you know, the other side of a mansion. I live in New York City. Everybody can hear their neighbors, so they can hear their babies very easily in the, you know, walk-in closet that has become the bedroom. So, but I think that is important, and I think that there is sometimes this feeling that these rules have been made that makes you a sort of good parent, which is like having your baby next to you at every moment. And you know, it's very important for parents to take care of themselves, their needs as well, and not to, you know, if someone's at their wit's end and exhausted, you're better off putting the baby in the bassinet, walking away. And if the baby's crying, that's okay if the alternative is, you know, you falling asleep on the couch with the baby because you're so exhausted, you know, and I think we have to have a little bit more compassion for parents when they're just exhausted.
Yeah, completely exhausted. And the other thing that we see a lot at Nanit is that parents are telling us that that we have really helped them with the transition to the nursery, so that just being able to see the baby, hear the baby, you know, from their phone and from whatever device they're watching the baby on, that it really helps relieve that anxiety that they're feeling in having the baby away from them. So it's one thing that we're super proud of and love that we've helped families, you know, make that transition, because we know that it's hard to, you know, hard to sort of juggle between, I really need my sleep and I know the baby's fine, but I've got to, but I'm told I have to have this baby in my room for 12 months. And it can be really hard for families to sort of, to make that decision and that move. So we were all excited to see the recommendation change from 12 months to 6 months. But to your point, it's a very personal and family specific decision when they're going to move their baby to the nursery. There's a lot of babies who are in the nursery from day one. So we don't want people to. We understand that it's a very, it's a very, very personal decision based on your own circumstances. So I wanted to ask now, we have a few questions that have come in the chat. And so I'm going to pass this one. I'm going to give this one to Dr. Gradisar. Okay. When my baby is outside our home, at my in-laws, let's say, she loses her typical sleep schedule and it's really hard to get her to focus on eating or napping. What do you recommend?
Keep it up, probably, because it goes back to that learning principle that babies need to learn to be able to fall asleep. And so it sounds like the baby's gone to a new environment. And, when we go to a new environment, you want to sort of check it out. You're sort of a little bit more excited. But if you retract from that and you think, oh, this is not working, only if you've, sort of done it 1 or 2 times, it probably means you haven't sort of allowed the infant to adjust to the new environment and to sort of learn to sleep there. So I would say try to keep consistently trying to persist with that, believe it or not. Don't shy away from it.
And also too, I would suggest too that, talk to your in-laws about the schedule that you would like to have your baby on and see if they can try and follow the same schedule and sort of help them understand how important it is to your family and how important sleep is to your baby. And to Liza's point, really knowing, and understanding and prioritizing that your baby has a need for sleep. And as much as those in-laws may want to, have the baby up longer because they want to play with the baby and they're there for this, very sort of short condensed period of time, that it's really important to you that your baby is maintaining that schedule. If you can try and have that conversation with them, I think it might be helpful as well. Let me move on to the next one. This is a good one for you, Dr. Ordway. How would you address maintaining a routine and the child spending a week at daycare where the routine cannot be followed?
So I saw that question in the chat and I was a little bit unsure if the idea was where the routine was, but I think it's an easy answer, whether it's at daycare as a routine or at home. I think, childcare centers are very sort of rigid and routine, right? The lights go out at 1 p.m. often and the lights come back on at 3 and the children don't move from their cot or their crib. And so it's very sort of structured and our lives don't often work like that, on the weekends or on a day off. And so I think, all of this is sort of pulling away too from having to do everything perfect. So in child development, we say, being a good enough parent 30% of the time. We're going to mess up, right? It's about how do we recover and how do we sort of, during that 70% of the time, how do we respond to our children? And I think sort of what Dr. Gradisar was saying about continuing to be persistent with the grandparents even, it's about, we want to focus on quality of time, not necessarily quantity of time, right? So it's that if you can think about that in terms of, the routine is going to have to be somewhat flexible because there are going to be changes, whether it's daycare or a weekend at the grandparents or a week off on vacation. But it's, if you can just continue to have, we talk about sort of mentalizing, thinking about what is the mental state behind the child and say, acknowledge the feeling, I wonder if you were a little scared last night or it was a little off, but we're going to get back on our routine and sort of recognizing that you're going to be frustrated. When I work with parents in sleep training for a little bit older children, and I get back to that sort of keep being persistent. I usually say about after the 10th time, it can get frustrating. So go into your room, take the pillow off your bed and put your face in it and scream, because it is really frustrating, right? And so as long as you don't let the baby or the child know that, they want to hear, you want to give them the same sort of calm, responsive tone, but recognize and don't beat yourself up when you get frustrated.
Okay, great advice. Thank you. Dr. Natalia, I'm going to ask you the next one. My baby is 3.5 months and I've noticed that his sleep patterns have changed. I fear we're on the verge of the dreaded 4-month sleep regression. What are some things I can do to help his sleep patterns, to help him as his sleep patterns change, that can help us both get some rest?
So I feel like sometimes the 4-month sleep regression has sort of a mind of its own. Like, I feel like it's one of these things that everybody talks about it, but not everybody experiences it. And it's like, you know, at 2 months, they'll be like, is it an early 4-month sleep regression? You know, and I find that by and large, if you are paying attention, I mean, there are going to be fluctuations in sleep based on, you know, developmental milestones that they're reaching and different experiences and, you know, loss of routine. But I do think that being consistent as soon as you can be consistent again. So if something is a little bit off, a child is ill or you're away. And again, just following their sleep cues and paying attention to when they need to sleep in an effort to prevent them. I find that sometimes it's about babies, and the sleep scientists can answer how they see it, but I think sometimes it's about babies being sort of overstimulated and overtired. And there are changes in their, you know, in how they're experiencing the world that sometimes we just need to sort of back up. And I think what's really important is that if babies know we're anxious, they will feel it, they will smell it, they will see it, and they will use it to their advantage and not to ours. So if we are worried about the what ifs all the time, if we are worried that, like, okay, things are going really well, now the other shoe is going to drop, or, you know, the baby is starting not to sleep as well, oh my God, it's going to be a disaster, and they sense that, invariably it becomes a disaster. And so I think it's so important, like Monica was saying, you know, if you're frustrated, yeah, to look cool, you go scream in the pillow, but it's always about like looking cool and calm and unfazed. And I really do think that that makes a big difference in babies feeling like, oh, okay, well, they're calm and cool, so I guess I'm calm and cool.
Yeah, I love it. And I just wanted to add too, you know, my favorite thing to recommend for babies of this age is that I would love you to start having the baby fall asleep by themselves at the beginning of the night. When they can do that, when they have mastered that, it's going to be much easier for them to fall back to sleep when they wake up during the night, and those night wakings, those night feedings will drop very, very quickly. But very often we see a lot of, you know, 3-month-old babies who are, you know, very used to having a lot of things done to them to, you know, to get to sleep, and they can sleep these very long stretches. And as they get a little bit older, you know, these stretches can start to get a little bit shorter if the baby is waking up and needs what they had at the beginning of the night to get themselves back to sleep. So that would be the first thing that I would highly recommend that you do, is to try and get this baby to fall asleep by themselves at the beginning of the night if you can.
And I talk about that as early as you can do that. I agree that that's so important, but also that babies don't sleep through the night. Like, they go to sleep and then they're like deep sleep for 10 hours. It's up and down, and they may wake up and talk to themselves and then go back to sleep. And so you want them to be able to put themselves back to sleep. So if they're talking to themselves, it doesn't mean they need anything. They're just up talking to themselves, or, you know, banging their feet or eating their feet or whatever it is.
Yeah. Yeah. And we know that, you know, and to your earlier point, you know, you touched on milestones. You know, we are doing a lot of research at Nanit looking at how sleep is disrupted when babies are reaching their motor milestones. And we see it all the time. You know, that sleep can really be disrupted when babies are about to roll over, when they are about to sit up, when they are about to crawl, when they're about to pull to stand. All of these, you know, big motor milestones that they reach in that first year can be very disruptive to sleep. So, you know, so it may not be you know, the whatever regression per se, but it could mean that your sleep is a little bit off. Their sleep is a little bit off for a few days. And to Liza's point, you know, the sooner that you can get back on track, the sooner that you can get back to that, you know, that consistency, you know, the smoother these, you know, these little blips will be. Does anyone else have anything to add to that? Dr. Gradis.
Maybe just to this point is that Jodie Mendel, who's done a lot of work when it comes to infant sleep and has so many data sets on infant sleep, she's had a look at the data and she's tried to find this 4-month regression. She can't see it in the data when you sort of look, you know, over a population. But yeah, it would be an interesting experiment to sort of take a group of parents and say, the 4-month regression is a real thing. It's coming. And to say to another group of parents, the data says there's nothing there. One would predict, to the points that we're all making here, is that the anxiety about that probably is going to affect their sleep. So hopefully, you know, just have some reassurance that there isn't necessarily this impending doom. I think part of the question there was the dreaded 4-month regression. Just delete dreaded, you know, maybe, you know, it doesn't necessarily mean it's true. So hopefully you can just take some advice probably from this webinar to try to be a bit more cool, calm and collected.
To be very clear, so Pamela did not say dreaded. I took some creative license and added the word dreaded. So I want to so I don't want to call out Pamela and say that she'd said dreaded. That was me. But I know that people do say the dreaded 4-month sleep regression. So I apologize, Pamela, for adding that word in.
The other thing. Oh, sorry, Monica, go ahead.
No, I was just going to add just from, I think it's interesting what Dr. Gradizar was saying, and it also there's a question in the chat about nap schedules in newborns. And I think this is a good time to also talk about how that 2-process sleep that Dr. Gradizar was mentioning before, as well as, Pamela appreciated all the advice. So that's lovely to see. But there's also the sleep architecture, so sleep stages. So there are 4 stages of sleep, but in the first 3 and possibly maybe even a little bit longer, there's only 2 stages. So, so when babies, I'm wondering too, and I don't think this has been studied yet, but it could be that they're transitioning now to those 4 stages, and there's more cycles of sleep. And at the end of each cycle, there's a micro arousal, like a little tiny awakening. And if they are in bed where they were when they went to bed and they're not hungry, they're going to fall back asleep. But if they wake up and they're like, hey, what happened to mom or dad? They just put me to sleep, or I fell asleep feeding, they might wake up a little bit more. So there might also be something to that transition, which also adjusts a bit of the newborn schedule. I think don't make yourself crazy trying to get a schedule together in the first few months, especially first 6 weeks. And what I found also in my work as a lactation consultant, and it's often in the first 3 weeks, babies are sleeping more during the day and are up more at night. And that has to do with prolactin levels and such. So I think that is something that I saw a lot in practice, was those first 3 weeks being particularly. It's not that they have their day and night confused and their circadian rhythm is messed up. It's not, it's just physiologically a little bit, a brief time. It feels like a long time, but it gets better.
Yes, and then before you know it, your children will be in the family group chat texting you, fighting over text about what's for dinner. So that's all ahead of you as well. But anyway, moving on. Liza, I am going to ask you to add on to anything Monica said about sleep schedules for newborns, or sleep tips for newborns.
Well, I was going to mention that there are 2 reasons that people, depending on the age of the child, will blame that the baby is not sleeping. So under 3 months, it's gas, and over 3 months, it's teething. And neither of those reasons tend to be reasons that the baby is not sleeping. So we often blame teething for a lot that, we sort of joke that teething causes teeth, and that's about it. Their teeth, they, have teeth that come in at 6 and 2 and they're fine, and those are molars. But trying not to find excuses, it's usually because they're just, they're learning how to fall asleep or put themselves back to sleep, and sort of having, letting them learn how to do that, I think, is important.
Mm-hmm.
I think sometimes we intervene too quickly when babies are trying to sort of figure something out. And it's not to say, you walk away from a newborn and say, see you in the morning, but not necessarily assuming that every fuss or cry is distress. It could just be like, I'm having a hard time settling.
Yeah.
But in terms of the schedule, I think the one thing that's really important is to remember that as women, we tend to have babies, many of us have babies a little bit older, where we have our career before we are a parent.
Mm-hmm.
And we have control over our lives, we have control over our schedule, and it's very hard to have a baby who doesn't follow our schedule.
Yeah.
And they don't. And I think sometimes being flexible and realizing that it's very hard to put a baby on your time schedule, but rather recognizing what their needs are, and then kind of adjusting your schedule to kind of match with that. Because I think it sets up for a lot more stress when they're not doing it the way that you would like them to do it, just because it's very hard to control a baby in that way.
Yeah. And there's a great call out in the chat that I just wanted to mention. Am I safe to assume that you were talking about corrected age? My little one was in the NICU for 3.5 weeks. And so absolutely, we're talking about corrected age. So if we're, and Liza, you may want to address that. How long would you be talking about corrected age for a preemie typically, in terms of sleep? As in, we would not expect, a 6-month-old who was born 6 weeks premature to be acting, to be sleeping like a 6-month-old, right? So how long would you recommend that they use, the corrected age in terms of sleep?
I mean, I think a lot of it has to do with how the baby is doing in every other arena. So if the baby is getting the volume of feeds that they need, if the baby is because the sense I'm getting from the question was that the baby was on a very sort of rigid routine in the NICU, and that is because the nurses aren't stressed and picking the baby up every time the baby whimpers, or they're feeding the baby on a specific schedule as opposed to on demand. And so I usually would say not to focus so much. I mean, I guess the question is, do you have to do something differently than follow your baby's cues until a certain point? Because I would still say, just follow their cues. And if they sleep for 9 hours and they're gaining and thriving and feeding, then that's okay.
Yeah.
Or is it like, when can I sleep train my like officially sleep train? I'm not sure I know the question.
I'm not sure. Oh, from me, you mean?
Yeah, like in terms of, yeah.
Yeah. So no, I mean in terms of, if we're thinking about let's say, for example, our sleep schedule generator has a recommended schedule for a 12-month-old, has a recommended schedule for an 18-month-old. When would you recommend that people stop using their, corrected age? Or
So I would, with the exception of development, we don't use corrected age. So sleep is part of development, but if a baby is 4 months and 4 months out of the womb, then they may sleep 10 to 12 hours. So we don't use, like, we would just follow that based on their chronologic age,
Okay,
not their gestational age.
great.
The
Okay,
only thing that we correct for is their sort of gross motor, fine motor, language, social development.
okay, all right, fantastic, thank you. I'm going to move, there's a couple of extra questions. I know we're almost out of time, but I just want to get to a couple of questions. I want to get this one over to you, Dr. Gradisar. Is it important to have the baby nap and sleep in the same sort of white noise, dark environment as much as possible?
Simple answer is probably yes. Again, if you think theoretically about learning to sleep, you're creating the same cues, the same sort of environment as much as possible. So I would encourage that as much as possible to try to have the simulation of daytime sleep similar to what happens when they're going to sleep at night. And to take your point earlier, when it comes to trying to encourage your infant to fall asleep by themselves at the start of the night, that is when you've got the best chance biologically for your infant to fall asleep, assuming that their sleep biology has developed, because it's a combination of basically that buildup of sleep pressure that's helping them to fall asleep, but also their body clock is also starting to come down in terms of alertness around about that sort of same time. So whatever conditions are occurring around then that are working, try to see if you can simulate that for the daytime as well.
Okay, fantastic. Thank you. And Dr. Ordway, I'm going to ask the last one to you. We've been doing the last feed before bed to help my newborn sleep longer through the night. When do I need to drop that, or does she, so that they don't get confused as part of their bedtime routine? I think it's a great question. I would love you to answer it.
That's a great question. And I think there's a lot of confusion around that. I think that when we're talking about the last feed before bedtime, I don't think there's a reason why that can't be part of the routine. As long as when they're put back into when they're put into the crib, they're drowsy but awake. So I think the last feed where it can become more problematic is if it's feeding to sleep and then they're transitioned asleep into the crib. And so that doesn't support that sort of ability to self-soothe. I was just reading an article by a group at Harvard that just was reporting that with looking at 1 to 6 month olds, and they found that the last feed, if there was a feed right before bed, that they had a longer period of sleep before the first awakening, but it didn't change the total amount of sleep duration. So, I don't think there's a problem with the feed as long as the baby's transition, you're kind of waking them up a little bit to their point where they're drowsy and going back into the crib.
And Liza, one more question, because this is a really important one, and I think it's really right for you to answer. At what age do you stop waking the baby to feed them?
When they get back to their birth weight.
Fantastic. Okay, great. All right. So guys, I think, and I have an announcement to make. I wanted to announce the winner of our giveaway. So the winner of our giveaway is going to be Carrie. So Carrie, our community members will be in touch with you to give you the information that you need to collect your gift card, but you'll be getting a $100 gift card of your choice. So congratulations to Carrie, and thanks for staying on. I wanted to thank all of our panelists for joining us tonight. Your expertise is just so greatly appreciated, and we're just so thrilled to have you as part of our community. And thanks everyone for joining, and have a great night, and I hope those babies are sleeping beautifully. Thanks everyone.
Thank you.